Let's talk about healthcare. Really weird thing. Yesterday, we heard there would be a vote in the Senate about Obamacare or the Affordable Care Act repeal or the American Health Care Act, but we didn't know what was going to be voted on. Tons of reports yesterday in the afternoon saying, hey, Republicans have moved ahead on repealing Obamacare. Not exactly true. Republicans, with Vice President Mike Pence as the tie-breaking vote in the Senate, voted to start debating a bill which includes a possible Obamacare repeal. John McCain, who was recently diagnosed with brain cancer, showed up to a standing ovation, cast his vote in favor of starting debate on an Obamacare repeal, then spoke and said, as it stands right now, I wouldn't actually vote for the bills that have been proposed, but I do believe that we should start debate on this. The good news so far is what? Well, Republicans still lack 50 votes on any particular major policy plan, and they lack 60 votes on the parts of Obamacare that require 60 votes in order to repeal. Democrats and Republicans immediately moved on from this vote and went on to vote on one particular amendment, and that already failed, 57 to 43 in favor. But again, that was one that needed 60 votes in favor in order to pass. Here's what we can expect, and some of this is happening right now, Pat, so by the time people watch the show, either later tonight on Free Speech TV or by the time you go to the gym and get on the treadmill, like many of you do, and start listening to the episode, some of these amendments may already have been voted on, but here's some of what's going to be happening. One, the Better Care Reconciliation Act. This is one of the primary Republican legislations that would get rid of a lot of the Obamacare policies, including a penalty for people who don't have health insurance. It would cut subsidies. It would put in a different type of tax credit. This one would be a total disaster, just wouldn't work. It's already been scored. And the Medicaid expansion would also be phased out as part of this amendment. Total and utter train wreck. There's the Cruz Amendment. This is a Ted Cruz amendment, which would basically allow insurance companies to totally ignore the Obamacare rules. It wouldn't change those rules, but it would allow insurance companies to ignore the Obamacare rules for plans for individuals or small businesses. That's the type of plan I'm on, for example. It would allow them to bail on covering maternity. They could bail on covering mental health treatment in all but one of their plans. The rule would be you have to have one plan that covers those things. It can cost whatever it is they want to charge. Forget about Democrats. Even Republicans don't like that amendment, so that one is unlikely to pass. We've got the Portman Amendment. Senator Rob Portman actually has to think about all the people in his state of Ohio that benefited from the Medicaid expansion. So his idea is for people who are currently on Medicaid tax credits, for people who are currently on Medicaid, we will create a $100 billion fund to give them tax credits so that they can buy their own insurance if they switch out of Medicaid. Then you've got a straight repeal only bill. Senator Rand Paul likes that one. We were listening to him earlier, Pat, on the floor of the Senate talking about that repeal period. He's been against many of the proposed substitutes to Obamacare because he believes it still contains a lot of parts of Obamacare. He wants to go with the whole thing. And then most recently, we've heard about this skinny repeal. That's a new popular phrase. And it's not the latest. It's not going to be the result of the latest weight loss plan or diet. What that means is you get rid of 3 Obamacare provisions. You get rid of the individual mandate. You get rid of the employer insurance mandate, and you get rid of the tax on medical device manufacturers. The problem is, if you get rid of that and keep other stuff, you can no longer pay for the other stuff. In other words, these are some of the provisions that enable those other things to be funded.
Right. I mean, hearing all these different proposals, it just sounds as if Senate Republicans are trying to pass something, anything, because
desperate.
Then you can move it to the next step, which is conference, and you can join it together in some way with the version the House passed, which is the American Health Care Act that we all thought was dead.
Yeah.
And what this also allows them to do is to go home to their constituents during the August recess say, we moved to start debate on Affordable Care Act.
We did something, right? We did something, and they can't go back and have to explain, wait a second, Trump said on day one he was going to start working on this, and you've done nothing. The real situation here is these people are never going to solve the healthcare problem. We would only have new problems created by the, quote, solutions that have been proposed so far. We will track it. We're covering this closely. It will affect could potentially kick 10% of the country's population off of health insurance. The video you just watched was made possible by support from you. Please go to patreon.com/David Pakman Show. You can make a pledge of as little as $1 per month. And every dollar helps to support the work that we're doing, particularly in light of the YouTube ad boycott, which has been really bad.